Paget disease of bone is a chronic condition characterized by abnormal bone remodeling. Normally, old bone is removed by cells called osteoclasts and replaced with new bone by osteoblasts. In Paget disease, this process becomes excessive and uncoordinated, resulting in enlarged, weak, and structurally abnormal bones. The disease most commonly affects older adults and is often discovered incidentally during imaging studies or blood tests. Paget disease can involve one or multiple bones. The most frequently affected sites include the pelvis, skull, spine, femur, tibia, because these bones bear weight or protect important structures. Complications can significantly impact a patient's quality of life. Many patients have no symptoms initially. When symptoms develop, they may include persistent bone pain, bone deformities such as bowed legs, increased risk of fractures, joint pain due to secondary arthritis, hearing loss when the skull is involved. The symptoms arise because the newly formed bone is larger but mechanically weaker than normal bone. To understand Paget disease, let's review what happens at the cellular level. The condition begins with excessive activity of osteoclasts, which break down bone at an abnormal high rate. The body attempts to compensate by increasing osteoblast activity. However, the new bone is laid down in a disorganized manner. As a result, the affected bone becomes enlarged, highly vascular, and structurally weak, making it prone to pain, deformity, and fracture. Diagnosis is based on a combination of laboratory tests and imaging studies. One important laboratory finding is elevated alkaline phosphatase levels, reflecting increased bone turnover. Imaging studies may reveal enlarged bones, cortical thickening, areas of mixed bone destruction and formation. A bone scan can help determine the extent of skeletal involvement. The cornerstone of treatment is a class of medications called bisphosphonates. These drugs suppress osteoclast activity and help normalize bone remodeling. Additional management may include pain control, physical therapy, monitoring for complications. Treatment is particularly important for symptomatic patients or those at high risk of complications. The prognosis for most patients is good when the disease is recognized and treated properly. However, potential complications include fractures, osteoarthritis, nerve compression, progressive hearing loss. In rare cases, Paget disease can transform into a malignant tumor known as osteosarcoma. Thanks for watching. If this video intrigued you, don't forget to like, subscribe, and join me next time as we uncover more mysterious medicine. See you next time.